attentional device disorder.
Well, this is a workshop on global mental health which is organised by the McGill Social and Transcultural Psychiatry Division, where we're aiming to give people an overview of some of the major challenges and problems in terms of global mental health. But we have people from all over the world coming to learn about global mental health.
The work that I'm going to talk about is a project over the last 5 to 6 years in Kingston, Jamaica, in inner city Kingston, with high-risk children in an area that has had a lot of social breakdown, high homicide rates, and very low suicide rates, very high dropout rates, very high levels of street violence, and so on. Much of our discourse is about how a post-slavery society that then comes into independence, how that legacy, that collective legacy of slavery and the high rates of migration for economic reasons out of the Caribbean, plus the economic difficulties and the drug industry that siphons its way through Jamaica are very important ingredients in terms of the predicament, I would say, the social predicament that Rob was asking us to look at. When we looked at the whole issue about who were the most vulnerable and at-risk kids or people in the social space, it really is the youth by 15 to 25 who have very high rates of death by high-risk behaviors, of school dropout, and then you go into the issue of crime and delinquency on one side, and sexual dysfunctions and multiple problems and AIDS and all the things that go with that. And you have this whole problem of trying to catch this age group. And you have to ask yourself then, at what age do children become exposed to these issues, and at what age would you start if you wanted to address this as a social problem, as a social and mental health problem? And so the decision was made that you really had to catch kids. Certainly, the younger the better. I mean, we all know that nurse visiting programs that start in pregnancy are probably going to give you the most gains for preventing risk in terms of the baby itself and supporting the mother. But the other kind of peak time is when children enter school, because you have the possibilities of the school offering an alternate support and scaffolding to development at that point. So we decided that if you wanted to do an intervention that was socially relevant for mental health and wanted to address these broader issues, why not build on a captive audience? People go to school, and not only that, but the school by itself as a knowledge transfer group, teachers are a fabulous place to spend your time if you were going to actually transmit new levels of competency. We had a relationship in the Almontown area, which was a very high-risk area, with the principal of the school, elementary school in that area, who was very interested in addressing some of these issues with her kids, who were extremely disruptive and out of control, and with very low academic competence. We asked her for the 30 worst achieving kids, okay? Not the worst behaved, but they happen to be the worst behaved also, but it doesn't matter. If the 30 kids that were the lowest, had the lowest scores, basically, of her elementary group at the end of grade 3, and the control group we chose as being comparable behavior to that 30. Okay, another 30 kids. We took these two control groups, both genders equally matched as close as possible, and their intake, we did a kind of measure, then we used literacy as our benchmark, that is the achievement on these scores, and a CBCL Achenbach to look at internalizing and externalizing scores on intake in the two groups and at the end of the intervention. and the intervention was over 3 years. So the program that was developed was meant to be a literacy-oriented and social skills adaptation-oriented, and to build those adaptation capacities so that you could at least be teachable. That is one of the biggest problems in a classroom is when kids are very disruptive, they're not really letting anybody help them. So the engagement with the social order to even allow yourself to learn. And we made it fairly culturally embedded in that music is very important in Jamaica. We had we had artists involved with this program, mainly musicians. Physical activity, food was very important. We fed them, and there was a very structured intervention that we prepared. And the intervention really started as a summer program. That is that in one summer, the teachers from Almontown came with the therapists and the artists, and we created a kind of summer camp intervention for these kids. And we had them for the summer, and literacy was a hugely important part of this. And the project was called Dream a World for the first summer because there was a whole program with masks and creative activity around what kind of world would you like to live in if you had your choice, and who would you be in this world. So it was to open up an imaginative narrative space. And there was a performance that was required people cooperating on a task in a group. So this is the area of the city behind the place where we did the intervention. This is a typical classroom, just to show you the density of the classroom. Of course, there's one teacher for maybe 40 or more kids, and it's quite, as you see, it's quite dense. And this is the school from the outside. And these are some of the kids. And one of the big things for these kids when they first came into this group and they were chosen because they were doing the poorest in the school, was to give them all ID tags like this, you know. So there was a real big deal about getting your picture taken and having your name, and that you were really somebody. You got chosen for this program. Not that you got chosen because you were at the bottom, but you got chosen for something special. And so identity became a hugely meaningful construction around this. So if we again look at just principles, if you're looking at these kind of environments and trying to organize an intervention, and Carl Bell talks about this, what he talks about are 7 principles of re-engaging youth who are at risk for violence. He talks about a lack of social fabric, so that whatever you do to create a social fabric is going to be very important. Acknowledging that if you don't have accessible education and resources, you've really defeated the purpose in the first place. And is there a way to engage families and schools? Because those are collective centers. Are you providing any safe places, okay, for kids who do not have social skills and affect regulation skills? And what about how they learn how to say no more appropriately, or how to negotiate for what they need, or how to master overexciting, overstimulating. These kids are all precociously developing, okay? These kids have all seen violence and sexuality and murder in the street, and we're not going to be able to take that away. You can't undo it. It is there. So you have to say, well, how do you help them to cope with this? If you're going to develop something for those kind of high-risk populations, you have to always be aware. So we're in this for 5 years or 10 years or 20 years. So it's not like a small 1-minute intervention. We're starting with the summer program and then refueling. You see all through the school year, every second week, the same kids getting together. So you're reinforcing the mastery of what you've already done, and then you're accumulating this refueling over a period of 2 more years. And for us, this is very important because to do an intervention for one summer, if we had just done the intervention for one summer and then left these kids, I'm suggesting might have led to a more detrimental outcome. than refueling them, because you would be taking down, you would be creating an ideal environment for a short time, taking down defenses, offering something, and then pulling it away. Okay, and so a lot of the things that we had seen in the past showed that the outcome eventually is worse for those children than if you just didn't touch them. Okay, so we were very concerned about, would our intervention be detrimental? And so we thought, so that's for us why the refueling issue became very important. Is what could we measure that could really tell us if something's effective? And we said, well, it should be quick and dirty. It should be very simple. Like either you passed or you failed at the end of grade 6. And in terms of what happened, we saw that the match control group was just as symptomatic as the study group. We saw that in the study group, both of the genders improved academically. Okay. By the way, all of our kids passed the GSETs, so they were the very lowest in the school, and they had already been written off as probably not going to pass at all. But all of the 30 of them passed the GSET exam, and that was a knowledge transfer element, because those teachers went back into their school. And in fact, they were motivated to increase the tutoring services in the school, having seen the response in small group work. Okay, so there was a kind of a spin-off immediately that even the control group would have benefited from, because the school actually the school actually mobilized some kind of resources at the same time in parallel to us. So if you're talking about curbing criminal activity and delinquent activity, you have to look at it as a social agenda. It's a collective agenda. This is a very small piece of what you can put in. So how would you measure the outcome? Well, you'd have to measure for a long time to come to see, did that group really benefit? Like what you've put in at this stage of development has now helped them to get to high school, which means at least you know that they haven't bifurcated at that point. They have the strength of the possibility of literacy. They have more pro-social skills. They all got into good schools, by the way. So you've given them something, but then what would you need to give them to survive high school and adolescence, given the fact that all the other agendas are not going to change? It's a question. I mean, I'm just presenting it as a question.
Thank you very much.